This is Dr. Paul Durand. We're about to do a rhinoplasty on one of our lovely patients. So she's from out of state. She flew in to see us. As you can tell here, this is her lateral view. She has a little bit of a hump on this side, and then she has a little bit of what we call a droopy tip. So we want to really deep project her or bring her nose a little bit more closer to her face. And we want to achieve something like this. So part of the imaging that we do is to calculate how much of a hump we need to remove in this case, how much of the nose do we need to deep project or over rotate, whatever we have to do. And as you can tell here, the projection tells me I have to take some of the dorsal hump, part of it is bone, part of it is cartilage, and then also deep project her, bring the nose a little closer to her face, and also raise the tip and give it good support. Raising the tip doesn't mean you're going to over rotate or you're going to have a piggy nose, which some people worry about, obviously. A nose should look like it belongs to your face. And that's why it's very important to plan the surgery well and really align what the patient wants with what your plan is. So we're about to start the case. The first part of a rhinoplasty surgery is careful local anesthesia application. What does this mean? Basically, I use a local anesthetic with epinephrine to constrict the blood vessels and help with bleeding as we go through. So I do different injections in the nose prior to starting and making my incision. And this will minimize bleeding and bruising, allowing me to be more effective in my procedure. We've already entered the nose, done everything through a closed approach here. She's a good candidate for it. I already brought the hump down a little bit with the ultrasonic rhinoplasty. So now that's a little more straight, but now we still have to do some tip work and really make the tip match the rest of the nose in an elegant way. We've entered the nose here. I just want to show you her lower lateral cartilages, which are usually obviously inside the nose. And what I'm doing is I'm going to be reshaping them, giving them more projection, rotating the nose a little bit. And as you can tell, I already brought the little hump down without causing major trauma to the nose. So we're done with the rhinoplasty. We brought the hump down, elevated the tip, not too much, just enough to make it look better. And we corrected the deviation. So from this angle, you can see the profile. So it's nice and straight. We have a nice little super tip break. It looks feminine, but doesn't look overdone. And you can come from this angle, from the top, and you can see how the dorsal aesthetic lines look great. You know, we've preserved those. She's going to have a very nice result once she's done healing.